Most people think a stroke comes without warning. No signal, no countdown, just a person, fine one moment, devastated the next. That's the story most doctors never correct. And it's the reason over 795,000 Americans have a stroke every single year, and a staggering number of them had warning signs they didn't recognize, or dismissed, or convinced themselves wasn't serious. I've spent 22 years watching what happens when people miss those warnings. And I need you to hear something clearly before we go any further. A stroke almost always whispers before it screams. My name is Dr. Shigeaki Hinohara. I'm a vascular neurologist. That means I specialize in the blood vessels of the brain, what damages them, what blocks them, and what happens to a person's life when we catch the damage too late versus just in time.
Reflective. I've worked in stroke units at major hospital systems for over 2 decades, but the moment that changed how I practice, the case I still think about on quiet evenings, happened in my 3rd year of residency. A woman named Ruth came into the emergency department at 11:40 on a Tuesday night. She was 58 years old. Sharp woman, a high school literature teacher who read 2 books a week and still did crosswords in pen. Her daughter had brought her in because Ruth had mentioned over dinner that she'd felt a little off for the past day and a half. A headache behind her right eye that kept coming and going. A moment that afternoon where the words she was looking for just weren't there. She laughed it off, said she was just tired. By the time we got to her, the stroke had already arrived. Ruth survived, but the woman who walked out of that hospital 3 weeks later, she could no longer read. The books, the crosswords, the thing that had given her whole life its texture, gone. I replay that case not to frighten you. I replay it because Ruth had told her daughter about the headache and the moment with the words, but neither of them knew what they were looking at. I made a promise after Ruth that I would spend part of my career making sure people knew. This video is part of that promise. So let's talk about what your brain is actually doing in the hours and days before a major stroke, because this is where the story most people don't know begins. A significant number of major strokes are preceded by what we call a TIA, a transient ischemic attack. Some call it a mini-stroke. I don't like that phrase because it sounds small, manageable, the kind of thing you can wait out. The truth is, a TIA is your brain sending a distress signal under the most extreme time pressure possible. According to research published in the journal Stroke, approximately 1 in 10 people who experiences a TIA will go on to have a full stroke within 3 days. The American Heart Association has made it unambiguously clear. A TI is a medical emergency, not a warning you can sleep on, an emergency. Think of it this way. I always explain it to patients like this. Imagine you have a river running through a city. That river powers everything, lights, heat, every function the city depends on. Now imagine someone upstream presses their thumb into a dam. The water slows, the lights flicker, but the pressure releases. The city comes back online. Everything seems okay. That is a TI. The thumb came off the dam. The blood flow returned. The symptoms resolved. But upstream, the clot that caused the blockage is still there. It's still unstable, and it may not move off the dam next time. That flickering of lights, that is what you need to recognize before the power goes out entirely. Here's what that flickering actually looks like. It often begins with something so subtle that most people don't even mention it to a doctor. A sudden confusion. Not the foggy confusion of a bad night's sleep, but a very specific, sharp kind. A moment where a word you've used 1,000 times simply isn't there. You reach for it and your hand closes on empty air. Or you look at your phone and the sentence you just read doesn't track, even though you can see every letter. This isn't fatigue. This isn't stress. When the language centers of the brain, a region called Broca's area or Wernicke's area, lose blood supply, even briefly, word retrieval shuts down. The circuit simply goes dark. A study published in Neurology found that language difficulty is among the earliest reported symptoms in patients who go on to have a stroke within 24 hours. But it's also one of the symptoms most frequently attributed to something else: stress, poor sleep, distraction. I've had patients tell me, I knew something was wrong, but I'd been working too hard, so I just figured I needed rest. That is exactly what the brain wants you to believe. The symptom is quiet enough to dismiss, but it is not quiet enough to ignore. If you've had a moment in the past 24 to 48 hours where words failed you in a way that felt new, strange, or sudden, I want you to hold that. We'll come back to it. The next sign tends to come on differently. It doesn't hit you during the day when you're busy. It waits until you're lying in bed, the house quiet, and there's nothing left to distract you from what your body is trying to say. A sudden, intense headache, not the kind that builds slowly over a stressful afternoon. This one arrives. It can feel like pressure behind one eye, or a band tightening around your temples, or a pain at the base of your skull that makes it difficult to find a comfortable position. Patients sometimes describe it as the worst headache of my life, though that phrase usually refers to the headache that accompanies a stroke in progress. What we're talking about here is a precursor, a headache that is different in character from anything you've experienced before. The clinical term is a sentinel headache, and it deserves far more attention than it receives. The mechanism is worth understanding. When a blood vessel in the brain begins to narrow, develop a clot, or experience a small rupture, the tissue around it sends pain signals as a distress response. Think of it the way your skin goes red and hot around a wound. That reaction is inflammation, a biological alarm. A sentinel headache is the brain's version of that alarm, quieter, shorter-lived, but absolutely real. Research from the JAMA Neurology found that patients who reported an unusual, severe headache in the 24 hours before a major stroke had a significantly higher rate of pre-existing arterial damage that often could have been treated if they'd been evaluated in time. If the headache is new, one-sided, unusually intense, or woke you from sleep, that is the sentinel calling. And if you're thinking, but I get headaches all the time, that's exactly the right question to ask yourself. Is this one the same, or does it feel different in a way you can't quite explain? Trust that instinct. The brain is remarkably good at knowing when something is wrong. The problem is we're trained to talk ourselves out of listening. Now here's where it gets more serious, and I want you to pay close attention to this next part because it's the sign that Ruth had, the sign I wish more people ask me about. Sudden visual disturbances, not eye strain. Not blurriness from a long day at a screen. Something different. You may see double, two of something that should be one. You may lose vision in one eye or in part of your visual field for a few seconds or a few minutes. Some patients describe a gray curtain dropping over their sight. Others describe a flicker, like a camera shutter misfiring at the edge of their vision. The visual cortex sits at the very back of the brain in the occipital lobe. The blood vessels that supply it, particularly the posterior cerebral artery, are common sites for pre-stroke disruption. When blood flow is compromised in that region, even briefly, the visual system goes offline in exactly the way you might expect a computer monitor to flicker when the power cable is slightly loose. That's the analogy I always use. The plug isn't out, but it's not seated properly either. According to the National Institute of Neurological Disorders and Stroke, sudden visual changes are among the 5 classic warning signs of stroke, yet they are among the least recognized by the general public. In a large survey conducted by the American Stroke Association, fewer than 1 in 4 respondents could identify sudden vision problems as a stroke warning sign. 1 in 4. The rest? They would see the curtain drop, blink, assume they needed a new glasses prescription, and go back to what they were doing. Ruth had this. She'd mentioned it to her daughter only briefly. That afternoon, while sitting at the kitchen table, she'd lost the left side of her vision for what she thought was about a minute. She'd assumed she'd stood up too fast. She hadn't stood up at all. Let's pause here for a moment. I want to ask you something directly. Have you, or someone you love, had any of these moments in the past day or two? A sudden word that vanished, a headache that arrived in a new way, a visual flicker that lasted longer than it should have. Type yes in the comments right now if anything I've described sounds familiar. I read these, and this matters, not for the video, but because I want you to hear back from me that if it does sound familiar, the next step isn't more reading. It's a phone call. Moving forward, because there are still signs most people have never connected to stroke risk. One-sided weakness or numbness. And I want to be specific about this, because weakness is a word that gets used too loosely. This isn't the weakness of sore muscles. This is a specific, often sudden, loss of strength or sensation on one side of the body. It may be in the face, a drooping at the corner of the mouth, a cheek that feels numb, an eyelid that feels heavier than the other. It may be in an arm. A patient of mine once described it as, "My left arm felt like it belonged to someone else." It may be in a leg, a heaviness that makes the step you've taken 10,000 times feel somehow wrong. This is a hallmark of stroke because the brain is divided. The left hemisphere controls the right side of the body. The right hemisphere controls the left. When blood flow to one side is disrupted, the body's response is exquisitely, frustratingly specific. One side goes offline. The FAST acronym that the American Stroke Association made famous, face drooping, arm weakness, speech difficulty, time to call, is built around this principle. But what most people don't know is that the BFAST acronym, updated to include balance problems and eye changes, was adopted precisely because the data showed that posterior strokes, strokes affecting the back of the brain, were being missed by FAST alone. According to a 2020 study in the journal Stroke, patients arriving at the emergency department with posterior stroke symptoms, which often include dizziness, imbalance, vision changes, and crossed symptoms, were significantly more likely to be sent home initially than those with classic anterior stroke presentations. Sent home because the weakness wasn't obvious, because the presentation didn't match the brochure. If something feels wrong with one side of your body in a way that is new and sudden, even if it resolves, even if it seems minor, that is not the moment to wait and see. That is the moment to move. And this brings us to the sign I find most heartbreaking because it is the one that causes the most delay. Sudden dizziness, loss of balance, the world tilting in a way that makes no sense. I hear this one described constantly in ways that delay care. I thought I was just dehydrated. I've been dizzy before, it usually passes. I sat down and it got a little better, so I figured I was fine. Here's what's actually happening. The brainstem and cerebellum, the structures responsible for balance and coordination, are fed by the vertebrobasilar arterial system. When that system is compromised, the brain's entire sense of space and orientation becomes unreliable. You may feel as though the room is spinning. You may lose the ability to walk a straight line. You may have difficulty coordinating your hands, reaching for a glass and finding your grip is off, your movement slightly wrong in a way you can't explain. The analogy that makes this visceral for patients, imagine the gyroscope inside an airplane, the instrument that tells the pilot which way is up, even in clouds, even at night. When it malfunctions, the plane doesn't know where it is relative to the earth. That is what a cerebellar or brainstem stroke does to a human being. The gyroscope fails. The person loses their relationship to their own balance. A study in Annals of Emergency Medicine found that patients with isolated dizziness as their primary symptom of posterior stroke were misdiagnosed at rates as high as 35% on initial emergency department evaluation. 35%. These are people who came in, described their symptoms accurately, and were still sent home, sometimes with a diagnosis of inner ear infection or benign positional vertigo or anxiety. Let that sit for a moment. Over a third of people with a certain kind of pre-stroke dizziness are initially missed, even by trained emergency physicians. The symptom is that easy to misread. If dizziness arrives suddenly, at rest, without an obvious trigger, if it is accompanied by any of the other signs I've mentioned, this is not something to manage with water and a rest on the sofa. This is an emergency. Remember the patient I mentioned at the very beginning, Ruth, the teacher? She had 4 of the 5 signs I've described. The word failure, the headache, the visual curtain, the moment while walking from the kitchen to her bedroom the night before, where she had to catch herself on the doorframe because the floor seemed to shift under her. She'd told her husband she must have stepped on something. She hadn't. The convergence of those signs over 36 hours, that was her brain escalating, trying harder and harder to communicate what the body didn't have words for. She made it, but reading was gone, the thing she loved most in the world. I think about her every time I record one of these videos, and I think about how different that outcome might have been if anyone in her life had known what to look for, if she had known. So what do you do with this right now? Not tomorrow, tonight. First, learn Be Fast. Not as an acronym, as a set of human symptoms you can recognize in yourself and in someone standing next to you. Balance, eyes, face, arm, speech, time. Second, understand that a TI, a mini-stroke, is never something to sleep off and reassess in the morning. The American Heart Association recommends evaluation within 24 hours of TI symptoms, and the data is clear that early evaluation and treatment in the hours after a TI reduces the risk of a subsequent stroke by up to 80%. 80%! The window is real. Don't let it close. Third, have a conversation tonight with your partner, your parent, your adult child about these signs. Not dramatically, just, if you ever see me suddenly unable to find words, or if one side of my face looks off, I want you to call 911 immediately. Don't wait for me to insist I'm fine. Because here's the thing about strokes, they rob people of the ability to recognize that they're happening. The part of the brain that would say something is wrong is often the part that's being damaged. Your people need to know what to look for because you may not be able to tell them. Share this video with someone tonight, not because the algorithm needs it, because someone in your life may be in that 24 to 48 hour window right now, dismissing something they shouldn't. You may not know who it is, but you know someone. Tag them. Send it to them directly. You might be giving them something they didn't know they needed. And if you're watching this alone, late, the house quiet around you, and something I've said has resonated in a way that's more than academic, please call your doctor first thing tomorrow. Or go to the emergency department tonight. Not because I want you to be frightened, because I have sat across from enough people like Ruth to know that the difference between the life they had and the life they ended up with was usually one decision made in one window of time that didn't stay open. That window is open right now. Use it.